Today I'm taking you through some physical therapy exercises for knee pain. So this is actually the newest version of my most popular video, which is physical therapy exercises for knee pain. And I know so many of you have benefited from that video. So I'm hoping that this helps as well. So let's talk about knee pain. I've been a physical therapist for 24 years, and these exercises today are kind of the most basic things that I give some of my clients who come to me with knee pain. So I'm not here to diagnose you today. I just want to give you a few things that might help if you're suffering from knee pain at home. So the only thing that you'll need is a towel. This is just a hand towel, and I have it rolled up. So I want you to have that close. All right, so you are gonna be seated, and you will need to do this on the floor or the bed. The bed would be fine, but I want you to be able to get your leg straight out in front of you. So what we're gonna do is have the leg out, and I'm gonna start with my right leg here. So the leg is straight out in front of you, and I want you to tighten this thigh muscle right here. This is called a quadset. I'm gonna talk you through a few of them and explain why it's important. We're trying to hold that for 10 seconds and then you relax. All right, so again, you're gonna squeeze this thigh muscle, almost like you're trying to really straighten your leg. I don't know if you can see, I actually can cause my foot to lift. That's how tight I'm trying to get that leg muscle here, that thigh. Pull the toes back towards you as you do it, and then relax. And again, squeeze and pull back. We're gonna go for 10 of them here, and I'll just do them with you. Okay, we're again trying to hold about 10 seconds. And we're gonna do both legs. So if you are ever in a hurry during the day, or if you're just trying to do a few things, then you can just do a few of these quad sets on the injured side. But I always like the idea of doing both. It helps to keep you even, and it can also help prevent knee pain on the other side. Now, knee pain can be caused by many different things, but what this exercise does, and remember, you're holding it 10 seconds and relaxing, okay? I just want to talk to you as you're doing this. So I trust you to kind of count to 10, pull that foot back, squeeze, hold, and then after about 10 seconds, release. So what this exercise does is it starts to kind of help, especially a muscle we call the VMO, vastus medialis oblique. It sits just a little bit on the inside at the top of the kneecap. It's part of your quad here, part of your thigh. And it helps to kind of kick that in a little bit to help just situate the kneecap where we want it to be. Many times, knee pain can be caused by that kneecap, your patella, tracking a little bit laterally. So we're gonna help wake up that muscle to get that kneecap back where it needs to be. And again, this is just for generalized knee pain. This can help with things such as arthritis, such as even meniscus tears or ligament injuries, tendon injuries in the knee, those kind of things. All right, we're gonna do one more. And it's okay if it hasn't been exactly 10. I like to explain a lot. Again, I'm a physical therapist. I want you to understand why you're doing this, because I think it can then empower you and encourage you to end up doing more throughout the day. All right, nice job. Now, we're gonna stay on that leg. And I want you to take that towel roll and put it under your knee. And you're gonna come back and lean back onto your arms, okay? And what you're gonna do is tighten that thigh muscle again, and then lift your foot so it comes off the ground, and then lower back down. So I'm tightening and lifting. This is called a short arc quad. It just means that we're again encouraging that quad to work. I'm holding it just a few seconds here. You don't have to hold it 10. You're just kind of holding it for that full exhale, just enough that you are able to hold the position. You don't want to bounce in and out of it. So ultimately, like what I want you to be able to do, and if I was seeing you as a client or working with you, I would eventually have you up doing squats and lunges, on and off the ground, stairs, all of those really important things for leg power and strength. This just happens to be the very foundation piece, okay? This routine is kind of that place that can help to start. to, again, wake up the muscles we want to be working and to get you back where you want to go. It's not the end all be all, but it's a really, really important and great starting point, and you can do these exercises every single day. Okay, now take that towel out, lean back again, and I want you down on your elbows, or you can just be on some pillows, like prop up 3, 4, even 5 pillows. So last thing, tighten the quad again, lift the leg up to about a 30-degree angle, back down. So tighten, lift, lower, tighten, lift, and lower. This is called a straight leg raise. And I don't want you to do this completely flat on your back, because it's going to be all abdominals, okay? And we're trying to work on that knee. So again, you're either on your elbows, or you can just be propped up with a bunch of pillows. That is completely fine. Okay, let's do 2 more. And you'll see I'm just going nice and slow and deliberate. Okay, we have an entire other side to do. Now, if you're thinking right now, Jessica, these are really boring, you are correct. They are kind of boring. I'll turn around so you can see this leg. But that is one of the keys, actually for our quad set. Sorry, we don't need the towel yet. We're starting with quad set. So you're leaning back. You're just tightening this muscle and flexing your foot. So you pull the foot back towards you and you're trying to hold this one 10 seconds. And then release. And then continue. I want you to continue. Okay, we're gonna, again, go for about 10. But it is okay, and actually something I usually want. If you've ever worked with me or you've been in my unlimited program, I have said before, you've probably heard me say, I want you to be bored. Because once you're bored out of your mind doing these, it actually means you're usually ready for the next step. Because it means that your body has assimilated this, it's used to it, it's comfortable with it, and your pain has decreased, right? That's what it usually means. So it is okay. These basic exercises aren't meant to be sexy or fancy, but they work. They're efficient and they work. And then once you're feeling better, once that pain is managed or gone, then go find some of my other fancy videos of using dumbbells and doing your squats and high intensity and all of those things, or just getting on and off the floor. But you want to start here. Don't skip this part. And as I said, you can do this every single day, and I would encourage it. I would encourage it, doing it every day for at least 2 to 4 weeks if you're just starting out. All right, we have 2 more. And this whole thing is going to take us less than 15 minutes. So while it might seem kind of slow in the midst of it, in the grand scheme of things, 15 minutes a day isn't that much to make yourself feel better. Okay, take your towel roll, place it underneath, come back, and we're gonna squeeze and lift your foot. And here too, we're going for 10. So if you get to the point that you have this routine memorized, which you probably will if you're doing it enough, you can just do this on your own. And I want you to do 10 of each, okay? 10 quad sets, 10 of these short arc quads, 10 straight leg raises. The key is just don't rush it. You need to be able to hold it, you know, for a few seconds. But yeah, you can do them in front of the TV. Get down on the floor while you're waiting for your coffee. Okay, last 2. And if it's straining at all or causing some pain, try moving that towel around, adjust yourself, do what you need to do. All right, we're gonna take the towel out. I'm gonna come back, pull the toes back towards you. Your quad is tight. Again, it might be shaking even at this point. We're gonna do 10 where we lift, lower. And then each time I come down, I'm actually just retightening that quad, just to make sure that it's still active. And you can even completely rest in between if you want. 3 more. 3, 2, 1. Nice job. I want you all the way on your back and bring that towel with you again and place it in between your knees. And you could even use a big pillow here or a small Pilates ball if you have that. Okay, I'm just gonna use this towel. My feet are flat. Take an inhale. Exhale, curl your tailbone, roll yourself up into a bridge, which is this. I have my hips lifted off and then slowly roll back down. If this is bothering your knees, try bringing your feet closer in towards your buns, okay? Your feet might be too far away from you. So this is doing a few things. We're actually helping to articulate your spine. Believe it or not, that has effect on your hips and your knees. We're also working your glutes and your hips. And by having the towel there, it's working your inner thighs. So those are all really important when it comes to helping keep your knees strong. And we'll do 3 more here. And you'll see I'm just going, again, nice and slow. Slow and controlled is the name of the game. And then roll back down. And you can take the towel out, hug your right knee in. And then hug that left knee in. And on this too, you can just hold behind the thigh. If it hurts to squeeze on the knee, just hold behind the thigh. And then both legs and just rock side to side. And then straighten your legs out. Take a big inhale. And exhale, let it out. And again, you can do that routine every day, and it will help to start to strengthen those thigh muscles and your hip muscles and hopefully help your knees feel better. I'll see you on your mat soon.